Welcome to the training for healthcare professionals. Let's begin with the module which focuses on cleaning and maintaining medical equipment. Let's take a look at the key learning objectives. After completing this module, you will be able to explain why nosocomial infection control is important, describe what is cleaning, disinfecting, and sterilization, clean, disinfect, and sterilize medical devices. What do we understand by an infection? An infection is the invasion of a host, the patient, by a pathogen or microorganisms or germs that could cause an illness or a disease. A nosocomial infection is a hospital-acquired infection, when a patient catches an infection in the hospital. It can be reduced significantly through infection control. Let's find out why infection control is important. Infection control is one of the most important aspects of health and environmental safety. Healthcare-associated infections are among the top 10 leading causes of death. Increase in drug-resistant microorganisms leads to more severe infections. Infection prevention and control helps reduce overall cost compared to cost of treatment. Let's understand when and where it is done. Cleaning and sterilization of medical equipment is a critical component of infection control. This is required in hospitals, ambulatory surgical center, in or outpatient facility, dental or physician's office. Let's find out what cleaning is. Click the image to know more about cleaning medical devices. Removing all foreign material from devices by using water and detergents or soaps and washing or scrubbing the device must be done before any disinfection or sterilization process. Let's find out what disinfection is. Click the image to know more about disinfection. A process that removes many or all microorganisms except spores, done with liquid chemicals, for example, Virex, or by 70% isopropyl alcohol. The disinfectant must reach all surfaces of the device. Enough time must be spent for disinfecting the device. Let's find out what sterilization is. Click the image to know more about sterilization. A process to remove or kill all forms of germs, including viruses, bacteria, to reach acceptable level of cleanliness. Reusable medical devices, including surgical instruments that enter the human tissue or the vascular system, require sterilization before each use. Improperly sterilized or contaminated medical devices can cause surgical site infection. They pose a serious risk to the patient's safety or can even cause death. For example, HIV-infected patients' equipment that may be reused, unsterilized. Let's find out different types of sterilization. Click the image to know more about the types of sterilization. Autoclaving. Steam autoclave is the oldest, safest, and most cost-effective method of sterilization in the medical equipment industry. The steam reaches 121 to 148 degrees Celsius, 250 to 300 degrees Fahrenheit, in the pressure chamber, and all the germs are destroyed by heat. Primarily used for surgical equipment. Chemical sterilization. Many surgical instruments can't withstand heat or moisture and therefore need to be sterilized chemically, for example, with ethylene oxide. Radiation sterilization. This includes sterilizing equipment using UV rays, electron beams, gamma rays, and X-rays. Now let us understand the key essentials of the sterilization process. Click each key word to get more information. Temperature and cleaning agents. Conditions must be present To effectively destroy germs, temperature and cleaning agents must be used in the prescribed quality. Clean devices. Devices to be sterilized must be thoroughly cleaned to reduce visible residue to ensure effectiveness of the sterilization process. Intimate and adequate contact. There must be intimate and adequate contact between the sterilizer and all surfaces and corners of the device. Item checklist. Drag and drop the items you think are needed to clean and sterilize equipment into the green box. Let's find out how the procedure is done. 1. Wash hands and wear gloves. 2. Don PPE, personal protection equipment. 3. Wipe the medical device of any visible blood or residue with a cleaning gauze. 4. Rinse it with water, sterile if possible, wherever permitted. 6. Do an alcohol rinse or wipe with alcohol swab, followed by complete drying. 6. Follow with sterilization, autoclaving, chemical, or radiation sterilization. Now let us see a demonstration on cleaning and maintaining medical equipment.
The term sterile means free of germs and disease agents. Sterilization refers to the process that removes living microorganisms from materials and objects. The goal of product sterilization is to kill all microorganisms and spores. In addition, viruses, prions, infectious proteins, plasmids, and other DNA fragments are destroyed. This makes a sterilized product non-infectious, meaning you cannot catch diseases from it. Steam sterilization. Heating in an autoclave is standard procedure in most hospitals and doctors' offices. You see the sterilizer being loaded with surgery containers holding sterile goods. The containers serve as storage until the next patient treatment. The materials to be sterilized are treated with overpressure for a certain period of time and at a certain temperature. For prion destruction, the materials that are being sterilized should be heated to 134 degrees Celsius for 18 minutes at 3 bars of pressure. The air in the autoclave interior should be completely replaced with saturated water vapor. These sterility conditions are only guaranteed with Category B sterilizers. These create a vacuum inside the sterilizing unit before the sterilization process begins. This means that air is sucked out and replaced by water vapor. This guarantees that the materials being sterilized are surrounded by water vapor on all sides, an important condition for sterilization. Ask your doctor if he uses a Class B sterilizer, as these are, unfortunately, not the norm. If the doctor does not have a Class B sterilizer, it is recommended that you abstain from undergoing treatment because the instruments are not sterile. After sterilization, the containers are removed from the autoclave, and the surgical instruments are prepared for upcoming patient treatment. In the picture, you see a surgery container in which the instruments are neatly stored. Doctors' offices do not usually use surgery containers. This leads to an interruption in the sterility chain as soon as the instruments are removed from the autoclave and come in contact with hands and fingers. Sometimes the instruments are shrink-wrapped in a special paper foil that allows for short-term sterile storage of the instruments. However, the package cannot be damaged or the instrument immediately becomes non-sterile. Sterile instruments are useless if non-sterile covers are used. there are different options in terms of sterile covers. The use of disposable articles is safe, as these are sterilized by producers through radiation and are thus free of germs. Prior to surgery, you see how the instruments are sorted on a sterile disposable cover that serves as padding. Frequently, washable linen cloths are used instead of disposable articles. These are sometimes sterilized in an autoclave, but some doctors' offices do not do this. Either way, the linens are not sterile because even an autoclave cannot completely remove germs from the linens. How do you find out if you're in good hands with your dentist in terms of hygiene? Ask your doctor about hygiene guidelines. A conscientious doctor will happily answer your questions, while a dentist that has gaps in his system will not be so eager to volunteer information. Ask for sterilization protocols, Class B sterilizers, storage containers, disposable covers, and thermodisinfection device. There will be more about that in the video by the same name.
Points to remember. Dispose waste correctly after cleaning the medical equipment. Ensure unsterilized equipment does not touch sterilized ones. Be careful when handling autoclaving machines, as there is a danger of burns. Read the symbols on the equipment. If you are not able to understand, then seek the help of a nurse.